Have you ever wondered how intubation is done without muscle relaxants? Intubation, a procedure many of us might only associate with medical dramas, is a crucial part of ensuring a patient's airway remains open during surgery or in emergency situations. Traditionally, this process involves the use of muscle relaxants to ease the insertion of a tube into the windpipe. But did you know that there's a method that doesn't involve these relaxants? Yes, you heard it right. There's a technique for intubating without muscle relaxants. This approach relies heavily on the skill and experience of the anesthesiologist. It's a delicate dance, balancing the need to maintain the patient's airway with the desire to avoid potential side effects of muscle relaxants. Now, you might be wondering, why would we ever want to avoid muscle relaxants? Aren't they there to help? Well, while muscle relaxants can indeed be helpful, there are certain scenarios where they might not be ideal. For instance, in cases of known or suspected neuromuscular disorders, the use of muscle relaxants can lead to post-operative complications. In such situations, it's necessary to have an alternative method at our disposal. This is where intubating without muscle relaxants comes into the picture. It's a technique that demands a profound understanding of the patient's physiology, the anesthetic agents involved, and the art of intubation itself. The artistry of this technique lies in the anesthesiologist's ability to judge the depth of anesthesia accurately. The patient must be anesthetized deeply enough to allow for intubation without causing discomfort or trauma, but not so deep as to cause unnecessary risks. It's a fine line to walk, and it requires a deft hand and a keen mind. So as we can see, intubating without muscle relaxants is a complex process that requires a nuanced understanding of anesthesia. It's a testament to the incredible skill, knowledge, and adaptability of anesthesiologists worldwide, who continually work to ensure the safety and comfort of their patients, even in the most challenging situations. Now, you might be pondering, when exactly is intubating without muscle relaxants indicated? Well, my friends, this technique is a unique tool in our anesthetic arsenal, and it's not a one-size-fits-all solution. It comes into play in specific situations where the standard method of intubation, which uses muscle relaxants, isn't the best fit. Let's start with patients who have neuromuscular disorders. These individuals may react abnormally to muscle relaxants, leading to prolonged muscle weakness or even paralysis post-operatively. In such cases, it's preferable to avoid muscle relaxants altogether and opt for intubation without them. Next, we have those with a history of malignant hyperthermia. This is a potentially fatal reaction to certain anesthetic drugs, including some muscle relaxants. So, for these patients, we must avoid triggering a malignant hyperthermia event at all costs. And this means foregoing the use of muscle relaxants during intubation. And then there are cases where rapid sequence induction, or RSI, isn't suitable. RSI is a technique where we administer a potent induction agent and a muscle relaxant simultaneously to rapidly induce unconsciousness and paralysis. This allows for quick intubation, minimizing the risk of aspiration in patients who haven't fasted. However, there are scenarios where RSI might not be the best option. For example, in patients with a full stomach or those with a difficult airway, using muscle relaxants can lead to complications. Here too, intubation without muscle relaxants can be a safer choice. So, you see, intubation without muscle relaxants isn't just a backup plan. It's a crucial technique, tailor-made for certain clinical situations. And while it may not be the go-to method for every patient, when it's indicated, it can make all the difference in ensuring a safe and successful intubation. Understanding the indications for this technique is the first step towards mastering it. And as we delve deeper into this topic, we'll explore the how-tos and the what-ifs, making sure you're well-equipped to handle these situations with confidence and skill. With the indications clear, we delve into the technique of intubating without muscle relaxants. Now let's imagine we're in the operating room, ready to embark on this intricate journey. The first stage is the preparation phase, where we ensure everything is in order before we begin. It's like setting up a chessboard before the game starts. Patient positioning is crucial. The patient should be in the sniffing position, with the neck flexed and the head extended. This position optimizes the alignment of oral, pharyngeal, and laryngeal axes, making the intubation process smoother. Next, we need to choose our equipment wisely. A standard Macintosh laryngoscope is commonly used. However, a video laryngoscope can be an excellent alternative, especially for patients with difficult airways. Our endotracheal tube should be well lubricated and ready to go. Moving on to the induction phase, we need to be gentle. The induction agent of choice is typically propofol or etomidate. These agents are preferred as they provide good conditions for intubation without causing significant cardiovascular depression. As we administer the induction agent, we maintain a firm grip on the laryngoscope, ready to visualize the glottis. Following this, we perform laryngoscopy and intubation. With a steady hand, we introduce the laryngoscope blade into the right side of the mouth, sweeping the tongue to the left. Once the epiglottis is in sight, we advance the blade into the vallecula, lifting upwards and forwards to visualize the vocal cords. Now comes the moment of truth, passing the endotracheal tube through the vocal cords. This is a pivotal moment that requires precision and calm. Finally, we enter the maintenance phase. Intubation without muscle relaxants requires constant monitoring. We need to be vigilant in observing the patient's vitals, breathing patterns, and any signs of discomfort. The capnography waveform is our best friend here, providing real-time information about the patient's respiratory status. Remember, intubation without muscle relaxants is not a race. It's more akin to a delicate dance where patience, precision, and continual practice lead to perfect execution. This technique offers a valuable alternative when muscle relaxants are contraindicated or need to be avoided. Mastery of this skill can truly set you apart as an anesthesiologist. Though it may seem daunting, with practice the technique becomes second nature. So keep practicing, keep refining, and keep pushing the boundaries of your expertise. This is the art and science of anesthesia, a field where knowledge, skill, and compassion intertwine to ensure the best patient care. A crucial aspect of this procedure is confirming that the patient is sufficiently anesthetized for intubation. To ensure this, anesthesiologists must be keen observers, always on the lookout for specific signs that indicate a patient's readiness for intubation without muscle relaxants. One might ask, what are these signs? Well, let's delve into that. First and foremost, anesthesiologists look for loss of consciousness. It's important to remember that the state of anesthesia is not a light switch but rather a spectrum. The patient should be deeply unconscious, but not so deep as to risk hypotension or other complications. Next, the lack of response to verbal commands is a clear indicator that the patient is in a state of deep anesthesia. Even a soft call of their name should elicit no response. But remember, it's not just about what the patient doesn't do, it's also about what they can't do. Which brings us to the third sign, the absence of protective reflexes. These reflexes include coughing, swallowing, or moving away from a stimulus. Their absence is a strong indication that the patient is ready for intubation without muscle relaxants. It's a delicate balancing act that requires experience and a keen eye for detail. As an anesthesiologist, your ability to accurately assess a patient's state is key to the success of this procedure. Let's recap what we've learned about intubating without muscle relaxants. Today, we've delved into a topic that's both challenging and essential in the field of anesthesiology. We've dissected the reasons why you might need to intubate a patient without the use of muscle relaxants, and these indications can range from patient allergies to pharmacological interactions. We've also explored the technique itself, which demands a precise and steady hand. It's not just about placing the tube, but ensuring it's correctly positioned and secured. It's a delicate maneuver, requiring a balance of speed and gentleness, and it's no small feat to master. Furthermore, we've discussed the critical step of confirming that a patient is indeed ready for intubation. This involves assessing the depth of anesthesia, checking for signs of muscle relaxation, and ensuring the patient's safety throughout the procedure. It's a step that underscores the importance of the anesthesiologist's role in maintaining patient well-being. In essence, intubating without muscle relaxants is not just about the physical act of intubation. It's about understanding the patient, assessing the risks, and making the best decision for their care. It's a skill that goes beyond technique, encompassing knowledge, judgment, and empathy. Remember, intubating without muscle relaxants is a challenging but necessary skill in the anesthesiologist's toolkit. With understanding and practice, you can master this technique.